Dentists of Reddit, what is a product you do not recommend? After reading the comments, I can't imagine there are any real dentists here lol. Smile Direct Club and other male-in-teeth straightening services. They seem like a quick and easy fix, but can cause large amounts of irreversible damage. I would strongly recommend against them. The American Dental Association has sent complaints to the FTC about these products. My son's dentist has a bug up his ass about raisins and gummy candy. He brings it up at every visit, like we haven't been going to him for years. Colgate. However, 90% of my fellow dentists disagree with me. Not a dentist, but I definitely don't recommend falling asleep with Crest white strips on your teeth. My teeth hurt every time I breathed for 2 days. Charcoal toothpaste can rip off enamel according to my dentist. Not actually a dentist, but my dad is. He hates Oral-B toothbrushes because the bristles are too stiff and do more scraping/wearing against the gums than cleaning teeth. Sugar? Tom Main products or anything fluoride-free. I had to take a client to the dentist and she was told that Mountain Dew was like battery acid on your teeth. A different dentist said the same thing to my BF years later as well. Needed serious tag. Meth. Where is that goddamn dentist that hates sugarless gum? The question specifically asks dentists. Had a chip in my tooth, so grabbed a nail file and went at it. You don't have to be a dentist to know that's a bad idea. I fucked up the sensitivity of that tooth, man. Any non-fluoride toothpaste. Lollipops. Sippy cups for kids/juice in a baby bottle. And also don't use mouthwash after brushing. Pacifiers? Literally the root of all evil. Meth. There are 2 products I don't recommend, Coca-Cola and hockey pucks. Citric acid. There are certain types of dentures that we call tooth extraction machines because that is quite literally what they are. Mountain effin' Dew. My last dentist hated artificial sweeteners. He said they don't do anything different to your teeth than sugar and put people into the false sense of security that they didn't need to brush their teeth as often after having diet and low-fat sweet stuff. Any toothbrush with firmer bristles than soft should only be used for cleaning your house, not your teeth. Firm bristles will do nothing but wear away your enamel. Plaque is gooey and soft and it will get removed just fine with a soft brush. Also, don't scrub your teeth so hard the bristles get fanned out. You're not getting them cleaner, you're removing enamel. Other than that, use any toothbrush you like. As long as you use proper technique, they all work. I'm a dental assistant, but I work in a hospital setting with immunocompromised patients, so I get to learn from a lot of really amazing professor/dentists. Fluoride-free toothpastes are crap, you need fluoride, get over it. Non-fluoridated, over-the-counter mouthwashes like Listerine have limited benefits. Using them is generally fine, but I would rather people spent that money on other hygiene implements. Water pipes do not replace manual flossing. There is no substitute for flossing, and I'm kind of exhausted by people who don't floss and then insist they never get cavities. Just floss your teeth, you're not some super special genius for squeaking by while not flossing. Keep a pack of flossers in your car, or next to your computer or wherever you have downtime, and just floss your teeth. Mouth/night guards that don't cover a whole arch of teeth can lead to big jaw problems over time. If you're going to wear a mouth guard, make sure it covers your whole top or bottom arch, not just your front teeth. And for fuck's sake, if you grind or clench your teeth, you should invest in the custom-made night guard at your dentist's office. Just go for a hard plastic night guard, made by a dental laboratory. I've had to help crown teeth that were worn down to little chiclet-sized nubs, and after investing like $4K in their mouths, patients would decline the $150 night guard. You're going to grind your pricey dental work down in an attempt to save a bit of cash. We're not upselling you, we're trying to save your teeth. If you have severe TMJ issues, like I do, many dentists are very excited to be able to inject Botox into your masseter muscles lately. TD benefits are really modest compared to the price and risk. Wear your night guard, take the muscle relaxers on the weekend, and work out to manage your stress so that your body isn't burning off anxiety by grinding your teeth as you sleep. Finally, this is more niche, but if you or someone you know is going through cancer treatment, their oral health is super duper important. The immune system is usually working hard to protect the mouth, but chemo really hinders that. Pay close attention to brushing gently and thoroughly, floss properly, unless your doctor specifically wants you to take a floss hiatus for bleeding reasons, keep your mouth and lips well hydrated, use SPF 30 on your lips, even non-cancer having people should, and generally be nice to your mouth. Cancer treatment is already hellish enough without some dumb dental or gum infection going systemic. 9/10 dentists when offered $10,000 to endorse plastic explosive as good for maintaining healthy teeth and gums will agree that plastic explosive maintains healthy teeth and gums. 1/10 dentists has something called integrity. Charcoal toothpaste. For that matter, using actual baking soda toothpaste. Oil pulling. Hard bristle toothbrushes. Medium bristle toothbrushes. Whitening toothpaste. Sugar sweetened gum like double mint and juicy fruit. Drinking coffee, Red Bull, soda or anything other than water all damn day long. Just drink your shit and be done for a couple of hours. You are feeding the bacteria that cause cavities new food all day. Most any and all over-the-counter bleaching stuff. And most of all, jelly beans. But that said, I love me a bag of Starburst Fave Red's jelly beans more than I care to admit. Haven't seen any dentist mention cocaine, but that's usually the one mentioned at my dental office. Mouthwashes are just ways for companies to make money, generally speaking. Your mouth has good and bad bacteria in it. Mouthwashes with alcohol kill all the bacteria, and can dry your mouth with frequent use. You need saliva, and the good bacteria, to help neutralize sugars and acids from everything you put in your mouth. Your saliva helps prevent cavities and can slow periodontitis, gum disease. Having a dry mouth has been linked to oral cancers. Fluoridated mouthwashes are better but are necessary only once or twice a week. They tend to stain your teeth. If you are mouthwashing to help your gums, you are better off using salt water rinses, assuming it is a minor issue. If you are mouth rinsing for fresher breath, use sugar-free gum instead. For long-lasting, fresh breath, floss once daily, brush twice daily with fluoride toothpaste. Source: not a dentist, but almost 10 years in the dental industry, working as an Australian dental nurse for almost 30 different dentists saying the same thing. Not a dentist but nothing. The question is not for you and we aren't interested in what you have to say. Tampons. Everything you love in your favorite tampon brand, now with that delicious maple glazed flavor. Tampons. It's that time of the month. Meth. First thing that jumped to mind from my childhood. Colgate, but my 9 dentist friends say it's great. Battery acid. These comments are only worth anything if 4 out of 5 dentists don't recommend a product. Smile Direct Club. Sure, you can save some money now, but you'll eventually end up paying more to have it corrected properly. Do it once, do it right. Not related to the post, but does anyone else put toothpaste directly onto their teeth instead of their toothbrush? Edit, try it. I don't recommend Crest, it just sold the Crusts company's toothpaste. Sugar? 9mm in the mouth. I don't recommend the hyped charcoal-based toothpastes. Just like baking soda, sure, using them a limited amount, like once or twice, might give you the perception that your teeth are whiter, but people overuse them. They're abrasive and can wear the enamel off your teeth. Edit, so the toothpastes with baking soda as an ingredient aren't so bad. It's just that brushing with literal baking soda is a thing, and that's what is particularly abrasive. Also, Snap-on Smiles, the mail-order orthodontics like Smile Direct, etc. If you have really minor orthodontic issues, fucking go for it, I guess, but have a real orthodontist or a dentist who is comfortable doing ortho. Take care of your teeth. Braces, Invisalign, whatever. Also, Ambisol, whatever topical lidocaine/Oragel bullshit they sell in the dental aisle. That shit does fuck all for an actual toothache. It's a topical anesthetic that is meant for mucosa, soft tissue, that won't dull pain in an infected/inflamed tooth. It's for gums/mucosa, aka anything that doesn't classify as hard tissue. It would probably work on a bee sting or mosquito bite even. Also, fuck non-fluoridated toothpaste. You want to be fluoride free? Well, then you're removing an element that literally strengthens/remineralizes your teeth against the cumulative acid damage of bacteria in our mouths. You can mechanically brush away said bacteria, yes, but the damage they're doing will accrue and you'll still likely get cavities. Other benefits of fluoride. It's literally antibacterial. Like it kills bacteria. What do I recommend? Any toothbrush, manual or electric, is fine as long as you use it right. Google it. A video on YouTube modified base method. Brush your tongue too, or even get a tongue cleaner. Mouthwashes are okay too. Listerine in moderation, a fluoridated rinse like Act. Any fluoridated toothpaste. Just a tiny amount is necessary. Don't rinse your mouth after brushing, just spit. The residual toothpaste benefits your oral environment. Floss. I recommend floss. Brushes aren't gonna clean the points where your teeth make contact, a common spot for decay. The floss pick things are alright, but again, you gotta floss correctly. I know you'll think you know how to brush and floss, but just go check a YouTube video on technique. I'm sure you might change a thing or two. I recommend periodic, professional cleanings. Many people are prone to developing calculus, a harder, more resilient form of plaque, that can't easily be brushed off with a brush. You gotta get it scaled by a hygienist or dentist. Go do it once at least, and you'll find that your lower front teeth now feel different. They even have spaces between them that you can feel. Water picks are okay too. They're not a substitute for floss though. A great adjunct. Crest white strips and the like, they're fine? Use them as fucking directed. Some people will get sensitivity, that's a risk the product warns you about. Don't buy it on Amazon, leave the strips on for 3 days, and then give it a 1-star review saying that they ruined your life and now you're a homeless meth addict. You're just fucking retarded and can't read instructions. A night guard. Preferably one made custom at a dentist's office, but there are ones you can get at CVS or whatever too. If you grind your teeth, it can cause problems. You'll notice in 20 years when you literally have worn away your teeth and you look unesthetic. or have jaw pain, or expose the pulp of your tooth and need a root canal or extraction, or whatever else. I don't recommend giving any credence to the Netflix mockumentary Root Cause. The MD in it is banned from practicing medicine in whatever state, also having people die in his care. The dentists in it come from the same backwater clinic, probably paid to bullshit, unless they're all genuinely that stupid. The studies referenced have no legitimate data, just anecdotal claims that have no relation other than delusion. Anyway, that's all I'll go with for now. I didn't see any dentists in here, so although my comment probably won't be seen by many, maybe by a few, and they'll benefit from reading this. TL, doctor, read my post to find products to legitimately avoid and some to really make use of. Edit, sugarless gum sweetened with xylitol is also good for teeth. Edit again, xylitol can't be consumed by the bacteria in our mouth, so when you don't feed them, they die. Oral flora are geared to metabolize glucose/carbs, and xylitol is a sugar alcohol, so bacteria can just fuck the hell off and die. Edit 2, my formatting sucks, I'm sorry. But please read.